AMSA's very first virtual convention, our 70th overall. I've heard so much positive feedback, and I just want to thank all of you for attending. And I know that we learned so much, and I'm so excited because tonight we're going to learn a lot too. I'm very excited for this session. Today marks the 50th anniversary of Earth Day. Some of you may be aware that AMSA did play a role in the initiation of Earth Day. And tonight we have a very special guest, Dr. Mona Sarfaty, who will be speaking to us about COVID-19 and the environment and how health relates to the environment. Before I pass it over to Dr. Sarfaty, I just want to give her a grand introduction like I always do for our speakers. So Dr. Sarfaty is the director of the program on climate and health in the Center for Climate Change Communication. The program collaborates with medical societies and research organizations to increase awareness, research, and preventative activity regarding the health effects of climate change. As a family medicine professor, yay family medicine, and physician for over 30 years, Dr. Sarfaty has engaged in research and teaching focused on primary care, cancer screening, and public policy, including the health effects of climate change. She has lectured at national and regional venues, including medical societies, health plans, health departments, professional organizations, and government conferences. Dr. Sarfaty is the author of widely circulated guides, articles, and a book chapter on how to increase cancer screening rates in practice and on improving practice outcomes by using the features of the patient-centered medical home. She is also the author of 2 upcoming book chapters on climate change and health. Without further ado, I'm going to turn it over to Dr. Sarfaty. But as you all know, Dr. Sarfaty, like our other speakers, will speak to us for a little while, and then we have question and answer with her where we can learn even more. So thank you again, Dr. Sarfaty, for joining us this evening.
Oh, thanks very much for that introduction, and thank you for inviting me to speak this evening. It's really a pleasure to be here. And I'd like to just start by acknowledging all of those who have suffered a loss during this unprecedented time in which we're facing a deadly pandemic, and express my gratitude to the frontline health workers who are risking their lives to save the lives of others. And I'd like to express gratitude also to everyone else who is working to keep us fed, safe, sanitary, and connected during this time. So I wanted to spend a couple of minutes comparing the threat to our lives from COVID-19 and climate change. We think of them as very different, but in many ways, they're very similar. So COVID-19 exposes the danger of ignoring experts and ignoring data, and also shows how the public health and healthcare delivery foundations of our social and economic lives are essential to our civilization. COVID-19 and climate change are both real. They're very different kinds of health emergencies. Both are going to cause millions of deaths worldwide. COVID-19 in days to months, and climate change over months to years. Both are crises of environmental origin also. The public needs accurate and scientifically sound information to be able to protect our health. Both show that. And our government has failed to maintain the public health capacity that's needed to properly respond to COVID-19. So strengthening public health has to be a priority to protect against emerging health threats, including the health threats of climate change. If we ignore scientists' warnings, we lose precious time in mobilizing action to save lives. And also the health of the world's haves and have-nots are intertwined, and cooperation is essential. COVID-19 nor climate change stop at the gate of a gated community. Another important thing to realize is that the pathology of American racism is making the pathology of coronavirus worse. The disinvestment in minority communities shows up starkly in the disproportionate impact of COVID-19 on African Americans. As with COVID-19, the impact of climate change on vulnerable minority communities is made worse by the terrible toll of disinvestment and inequalities on communities that breathe dirtier air and have less access to health services. Heavily polluted air that doesn't meet EPA standards exists across the country. And the 2020 State of the Air report was just released by the American Lung Association, and you can there look up the air quality in almost every county across the country and see that air quality in many places is substandards, but it's often worse in minority neighborhoods. And to understand disinvestment, all we need to do is to look at the states that have not yet expanded Medicaid. You can see here really starkly displayed how many places in the country are not providing access to health services for a major part of the population. I don't know how much you all are familiar with Medicaid, but traditional Medicaid serves a tiny percentage of the population. And so without the Medicaid expansion, mostly people who need these services are not getting them. And that's not only the healthcare treatment services, it's the health prevention services. So the work of 4C Mason, which is where we're located, we're in the Mason Center for Climate Change Communication, which we refer to as Mason 4C. And it shows that African Americans and Latinx people across the country actually have a greater likelihood of being in what they have termed either the alarmed or the concerned groups of the 6 Americas. And those 6 Americas are the alarmed segment, the concerned, the cautious, the disengaged, the doubtful, and the dismissive. And what they've discovered in over 10 years of surveying representative samples of the American public about how they think about climate change is that these different categories correlate very well with people's willingness to take action or to support policy changes to address climate change. And so what we've learned is that the minorities who are minority communities, poor minority communities that are more vulnerable to climate change are also more likely to be in the alarmed or the concerned group. Although overall, we now have about half the population that are alarmed or concerned. And so our goal is to get that middle group, especially the cautious, who know that climate change is happening, but don't yet know that much about it, and to try to help them understand better so that we move them into the concerned or the alarmed group, and they'll be more willing to take action. So I'd say for those who wish to understand how they can interact better with those communities that are more vulnerable, that they should embrace environmental justice and either the students who embrace those or the groups that espouse it. And there tend to be more voices and a tremendous amount of energy for addressing climate change in those organizations. Offer to help those communities. You can validate their voices. They're often unlikely to come forward and ask for your help, but if you seek them out, you can find them and you'll discover that you can be of great assistance to them just because of your status in society as a medical student, which is definitely a highly respected group. And don't make environmental justice just an add-on. It's central. It's central to climate change, and it should be central to our actions to address climate change. And COVID-19 demonstrates this so clearly. You probably have all seen the news about the work done by the Harvard biostatistician who showed that across the country, those counties that have worse air quality are more likely to have higher COVID-19 deaths. So some Americans face greater risk from climate change. Everybody is at risk, but certain groups are at greater risk, and that includes children, because they spend more time outside and their parents may not be aware that it's now hotter in the summer than it used to be and that those children could be in danger. Pregnant women whose pregnancies are at greater danger from heat and from poor air quality. Elderly individuals, especially those who live alone or who may lack air conditioning or both. People with chronic illnesses and allergies are at greater risk. And so are people with limited resources, especially people of color, and people who have suffered environmental justice in the past. They may not be able to get out of harm's way when events threaten. And I think Katrina showed that very clearly. So how can AMSA advocate for solutions? Well, evidence is really strong that health is a highly influential way to talk about climate change. That evidence has been around for a while and it's only gotten stronger. Half of Americans don't realize that climate change endangers their health and their family's health. They think climate change, they know it's happening, but they think it's far away in place and far away in time. When they learn that climate change is harming people now, they tend to support solutions, and this is true across the political spectrum. So this work has been done at our center with people who do span the political spectrum, and many who are even in that dismissive and doubtful group do support climate action once they realize that climate is a danger to health. My advice would be the authentic young physicians that you are. Tell your stories, write your stories, express your personal concerns. Health is personal, and health professionals are the right group to talk about it. The other argument or the other approach that works very well is the moral imperative of intergenerational stewardship. And so as young people, you're able to make a very strong case for maintaining the amazingly beautiful world that your parents and grandparents treasured. Tell your personal truth about the things that you don't want to lose. Again, don't remain silent. As future physicians, your concerns are important to your hospital and to your medical school. And you can request a curriculum that includes climate and health issues. You can ask for meetings with the hospital leadership and find out what they're doing to protect the vulnerable communities in their catchment area from climate change. If you're respectful in your concerns, I think you'll find far more receptivity than you imagine. This graph here shows the incredibly steep rise in the cost of environmental and climate disasters, weather and climate disasters. The gray line is the average since 1980, and you can see what's happened in the most recent years. It's quite a bit more expensive than that. This may be one of the benefits of having gone through the COVID-19 crisis. People may now understand a little bit more about curves and flattening the curves than they did before. This is a cartoon from Tom Tolles, who's the Washington Post cartoonist, and every morning he brightens my day when I look at his cartoons. So let me stop there. I'd be happy actually to continue, but I'm very aware of the fact that there's a great interest in asking questions. Should I give a few more slides, or should I stop and allow some questions at this point? What would you prefer?
We can do a few more slides, and then we can do the questions. We have time for you.
Okay, great. Okay, so the good news is that clean renewable energy is growing. 30 states now have renewable portfolio standards, and another 7 have voluntary targets. This means that 1 of every 3 Americans is living in a community that is committed to or achieved 100% clean electricity. So my organization is the Medical Society Consortium, and it's comprised of 29 medical societies representing together over 600,000 physicians. And also we have 44 public health affiliated groups who represent millions of members. The mission of the consortium is to organize, empower, and amplify the voices of America's doctors and other health professionals to educate the public and policymakers about how climate change is harming our health and how climate solutions can improve it. So when we talk about climate solutions, I think it's worth noting that there are very specific ways that climate solutions benefits our health. Clean energy creates less soot, less pollution, less ozone, and healthier air. Active transportation, which includes walking, biking, or public transportation, is cleaner and better for your health, does not create fumes. Cleaner air, better for your health. Diets with more vegetables and less meat are healthier and produce less methane. And cities that have more trees and cooling greenery absorb more carbon dioxide and help protect people from the heat. So with regard to intergenerational equity, if we invest in policies that support building a healthy economy for the 21st century in a way that will create new jobs and a just transition for working people and communities that are adversely impacted by climate change and by the transition to a low carbon economy, we will be favoring a healthier future and helping to support a healthier life for our children and grandchildren. I'd like to draw your attention to these 5 posters that we have available on our website under Educate Your Patients. And each one focuses in on a behavior that, or a climate action that also benefits your health. And these are available for download. They can be put up on an office wall, printed out and given out as brochures, and also just shared on social media. So finally, the COVID-19 crisis presents real dangers, tremendous dangers, but also opportunity. Health messengers are going to be even more important now than they were before. And we need to advocate for a better functioning society, not one that merely gets back to normal, but one that builds a better future. Thanks.
Thank you so much for that. That was very informative, and you actually kind of answered some of the questions, but I'm going to now jump into the Q&A part, and I know that this is a part that people love. And so without further ado, my first question for you is, what can we do as young health professionals to help contribute in making sure the Earth is more sustainable?
Well, I think, there's so many things that you can do, and it's always a good idea to start where you are. You probably are familiar with the fact that healthcare and the whole health sector of the economy produces about 10% of all greenhouse gases that are produced in the United States. And so this means that having more efficient use of energy within the hospital environment and within the environment of our medical offices, and reducing our energy consumption can actually contribute directly to less energy demand, which means less energy production and less pollution that goes along with that. And if you want to think about how to approach this from the office perspective, I highly recommend you go to mygreendoctor.org, which was established by Dr. Todd Sack, a gastroenterologist who lives in Jacksonville, Florida. And he describes how you can, in 5 minutes a week, with a small number of people in your office who are interested in improving your environmental footprint, can make tremendous progress, reduce your energy use, improve your energy efficiency, and save money as well while you're at it. For those who are spending more time in hospitals, some hospitals are focusing on this very heavily and are already engaged in trying to improve their efficiency and reduce their energy use, but others are not. And so as students, you're in a position to really go to the hospitals where you're practicing and to explain to the powers that be at the hospital that you are very, concerned about climate change, and you understand that hospitals are, are high energy use institutions, and you'd like to understand more about how the hospital is approaching this. And as young physicians, early career physicians or residents, the likelihood is that they will be very responsive to your questions, and they will be very willing to set up a meeting and to talk to you about what they're doing, and give you an opportunity to talk about your concerns and to learn more about what's happening at the hospital. Once you're in that kind of a conversation with the folks who, the executives at the hospital or the leaders of the hospital, you're in a stronger position then to become involved. If the hospital doesn't have a green team, you could potentially start one, but there's always a good chance that it will have one. Then in terms of the communities that you're going to be living in, many communities have different resilience challenges. And depending upon what those challenges are, you may, once you learn about them, be able to get more involved. You're also already a bit of a medical expert. You have a great deal more knowledge and understanding than most lay people out there. And so if you're inclined to give talks at the local library or in your place of worship or in another community setting, a community center, it's very likely that they would welcome your offer of sharing information. And we have downloadable slide sets that we would be happy to make available for anybody who would take that route to being involved.
Well, you heard Dr. Sarfaty. Something that we love doing here at AMPS is empowering you to get out and lead. And so she is providing that opportunity for you. I know you spoke about this a little bit during your presentation, but the question for you is, do we need to change med school curricula to include more about how the environment plays a role in health? This is something that we all too often are not exposed to.
Yeah, there's quite a bit of work going on that, and but it requires more, that's for sure. There is a group of medical schools and public health schools that have identified this as a very high priority, and they established a group called the Global Consortium on Climate and Health Education. And so they are encouraging schools to make climate change and its impact on health more a part of the curriculum. So some schools are already thinking about this. Some places there are individual instructors who have taken it on themselves to try to add components to the curriculum. I've got a colleague who offers a hour session during the first year of medical school. I have another colleague who's put together some case studies that she uses during clinical rotations when she does internal medicine rotations with students. And I know other colleagues who have put together courses that are being shared in medical schools, but it's not really a standard yet. And so I think getting to the point where it's a standard will mean that this information will reach many more students than are currently being reached. And so this is something that can also be taken up by students with schools. Go, speak to whoever is responsible for the curriculum committee, maybe get some other students involved, express your interest in having climate change be more a part of the curriculum. And it's possible that the committee can help think about how to do that within the context of your school. It's certainly true that there's a lot of competition for the hours of medical education. There's many faculty members, everybody wants a little bit of time to be able to educate in their area of specialty. So it can be difficult, but it's also true that many disciplines could be focusing on climate change, but are not currently. And an example of that is the time spent on lung disease. Could be talking about the impact of heat and growing intensity of heat waves on people who have asthma or who have chronic lung disease. They could be talking in the sections on allergies about how the pollen counts are getting larger as more of the allergenic plants spread into new places around the country, bloom earlier and stay bloomed longer and produce more pollen. And so, within that piece of the curriculum, it's also true that, for those who are teaching cardiology, making sure to include a little bit more about air pollution and how that impacts heart disease and the extent to which climate change has some impact on air pollution. There's just so many places in the curriculum where there could be more focus on this. Of course, another one is infectious diseases, tick-borne disease, mosquito-borne disease, and so forth. And so if all of these components of the curriculum were encouraged to include what's relevant to their specialty in the education that they give, it wouldn't require a big change. It would require many small changes, but the sum total would be a much more focus on this topic.
Yeah, very good points. Thank you. The next question for you, the Trump administration wants to scale back on the Clean Air Act enforcement in a time when we need these protections the most. Minority communities are being disproportionately affected by pollution, and as a result, they're having worse COVID-19 health consequences. What can future physicians do to better protect minority communities from climate change?
That's a very good question. It's a really important area to think about. And I've come to the conclusion that one of the things that is most important to do is to support communities that are experiencing these disproportionate health impacts and poor environmental conditions in their efforts to bring attention to their problem. So that may mean not always leading on an issue, rather supporting on an issue, but there's just a tremendous amount that the voices of medical students or physicians can do to validate the concerns and the efforts of communities that are already facing this disproportionate negative impact from poor air quality and climate change. And so, it often, to figure out how you can do that means reaching beyond the walls of your medical school. It may mean reaching out to an environmental justice group in the community. Something like, it may mean going to a group like the NAACP or the local city council, asking them what they know about who's involved in environmental justice, and then seeking out the community leaders who are trying to do something about this and asking what you can do to help. And, again, it's likely that you have so much more knowledge and education under your belt than community leaders do, especially about health issues, that you can be a tremendous help to them by validating, explaining, offering to appear with them at hearings at the city council and on this type of thing. And we often don't think about that as a role for ourselves. It's something that I've begun to realize after many years, but it's crucial, and it could make a very great difference. This is where our knowledge and education, can really change the equation.
Thank you. Next, my guess is most people are going to revert back to their old ways after the pandemic. Will all of the positive outcomes that we've seen around climate change be completely lost? How can we measure that?
Well, some of the most obvious impacts are going to be seen from space by satellite. So, those in terms of the amount of pollution that is occurring in certain parts of the country, apparently is very easy to see from a great distance. And there's a dramatic change that's gone on where we no longer have so many vehicles, and, we don't have industry operating at the same level because so many people are not coming to work. And so we'll see that come back when it comes back. I think, the point is that we have to figure out how we can not make the argument that that was better, because that will undercut, the argument that we're trying to make, that as we rebuild our economy, we want to rebuild it to a better economy, one that's not so polluted, one that doesn't cause the kind of negative health impacts that we've seen before, one that allows for job growth as we develop new cleaner industries. And so, to talk about the benefits of COVID-19, because we've had reduced pollution, is, I think, a losing proposition for us, because it leads us straight into the argument that others can make that, if we do address climate change, it's going to mean that we'll have this, a tremendous decrease in economic activity. And that's not an idea that we want people to get from all this. Rather, what we want them to think about is that our economy is really going to be in bad shape when this is over. Many people will not get their old jobs back. The unemployment rate is going to remain high for a while. And there's going to be some big questions about how to put people back to work. And so we want to be there at that time to say, when we put people back to work, we should be putting them back to work in industries that don't pollute, and in building a cleaner, 21st century economy.
How can we, here at AMSA, we focus a lot on empowering future physicians and the community around us, and doing so in regards to advocacy as well. How can we encourage those around us to be more engaged in advocacy and policy? And potentially, how could we use the consortium as a chance to illustrate the negative outcomes of how our climate has been? How can we encourage the rest of our society to get behind green bills and making sure that we put the government to work on ensuring what you just said, that people go back to work, and when they go back to work, they're working in areas that are more environmentally friendly?
Well, one way is to let people know that if we take certain kinds of action, that people will be healthier. And so, cleaner air, there's been just some tremendous work done recently. In fact, there was a piece published, Schaufnagel, I think, is the author. I can send it to you. You can just distribute it to others. But it quantifies the improvements in health and the savings, the monetary savings that we have gotten by cleaning the air. So in places where the Clean Air Act has been most effective, the return on investment is 32 to 1. That's how much of a benefit we get from cleaning the air. And that's exactly what this new economy would do. It would clean the air. We wouldn't have the kind of pollution that we have currently. And so we'd get a tremendous health benefit. And at this time, that's actually only somewhat quantified. But we need more people to study that, to measure it, and to let everybody else know just about how much, not only health benefit, but also financial benefit we get from that. So there'll be greater understanding of that. And I think, we know that that eating a diet that contains that has less meat and more vegetables and fruits is better for our health. We know that increasing our exercise, our activity level, is better for our health. It's better for our cardiac health. It makes it less likely that somebody's going to get diabetes and all of the problems that can go along with that. And so that means that public transportation or active transportation, biking, walking, etc., are healthier than taking the kind of using the kind of transportation which is based on vehicles that put more pollution into the air. And actually, if I can just, I wonder if I can go out of my screen and share. Let's see, can I share this graphic again? Are you seeing that? Hello?
If you go to share screen, it should be able to display whatever's on your computer.
Okay. I was afraid there that I had completely lost this, but here, let me find the right button. Okay, there's the right button. And there's share screen. Okay. So
there we go.
Okay, so if you look at these posters as an example, this is designed to be for the public in general, but I think, it's good for medical students as well. So you look at green buildings and living space as an example. So green spaces encourage physical activity, social connection, and they're cooler. And so green infrastructure like gardens, roadside plantings, vegetable gardens help to protect people from heat and also from storms and flooding. So, this is something that I think if medical students realize, it's something that they can also share in the patient care work that they do. The one right up on top here, healthy food systems, health benefit of climate action. Eating healthy plant-based foods and reducing meat consumption can lower blood pressure, reduce the risk of diabetes and heart disease, and help maintain physical health. And then on the right there, where it talks about using clean energy because we get cleaner air and water, and healthy and clean transportation. Opting to walk or use public transit reduces emissions. This improves air quality, which does less damage to children's lungs and can reduce asthma attacks. More walking and cycling can also reduce the risk of cardiovascular disease and diabetes and improve mental health. So, this kind of advice is advice that you can give patients. It's something certainly that every medical student should know. And, it's not only the pathology that goes along with climate change and all the dangers that we face, but it's also the flip side, which is how climate action actually does benefit our health. And we have a 10-point program for addressing climate change that's called the Call to Action on Climate, Health, and Equity, a Policy Action Agenda. You can find it at climatehealthaction.org. and it has 10 policies that will address climate change, most of which are also actively better for our health. And so we have been trying to send that positive message that addressing climate change doesn't just prevent illness, it's also better for our health. And there's a brief form at the climatehealthaction.org, and there's also a longer, more in-depth explanatory form of that agenda. And I would recommend it to everybody. And also, these posters are on our website. You can find them, you can download them, you can share them, you can use them as slides if you give presentations. And it's a way to get people's engagement with the issue that is not just about the warnings that we're giving. Because, we know that too much negativity tends to lead people to want to escape. It's not necessarily the kind of message that will get people to take action.
Thank you so much, Dr. Sarfaty. We really appreciate your time this evening, and I know that we learned a lot. Our Environmental Health Action Committee, I know, thanks you so much for capping off their day of action and being with us here on Earth Day, and so much that we've learned tonight. And I know here at AMSA, we will take some of your advice, if not all of it, and implement it as soon as we can, because this topic is so very important to us. For all of you listening, thank you again for tuning in. I know that these sessions have been so informative for me, and I hope they've been informative for you all as well. I look forward to seeing you on our next video series session. Until then, I wish you a good night, and I'll see you very soon. Take care, everyone. Bye.